Are you finding that patients are having an easier or harder time taking charge of their care and being more active in the process as a result of technology? How are
E-
they adopting that stuff?
It's easier. Hands down, easier. 10 out of 10 easier. Diabetes technology is developing like at the speed of lightning. We have so many different types of continuous glucose monitoring devices now. We even have over the counter biosensors. So people are coming in on those. I actually am in retail in my clinic and I do sell biosensors at my office. And these are available to any community members that just want to come in if they're curious about what their glucose is. People are even using these to almost self diagnose. So they're coming in and using biosensors, kind of getting an idea of what their glucoses are running. And they're coming into the doctor's office or an NP's office without even being seen. And they know all of their glucose. So it's helping tremendously.
Yeah, that's interesting that we find stories with like the Apple Watch or something and someone's like, I knew I was having a heart attack so my watch alerted me.
Right.
Kind of concerning is this idea that some people might be misdiagnosed or receive maybe an incomplete diagnosis. How do people who suspect they have diabetes or who have already gotten a diabetes diagnosis, what's leading them towards a second opinion? And what would you say to patients that are trying to gauge the quality or appropriateness of the care that they're receiving?
Sure. Well, the internet is wide open. So people are always using Google and all of the multiple social media platforms to get their information first. I think they're gathering information from multiple areas and arenas. And then they're using diagnostic tools, like you said, like the Apple Watch and glucose biosensors that are over the counter. And they're gathering things. And if they identify that something's abnormal, and especially if they feel bad. It's almost like people that are feeling bad and they don't really know why and they're having symptoms. They go the extra mile to use technology to get some data, and then they'll usually come into us to question it and say, hey, is this normal? Is this not normal? And there's certainly different variations where they'll get data and it is normal. And of course, there's conversations with reassuring patients. You bring this up, there's a limitation sometimes with technology because there was a big discussion at the ADA conferences this year, like how much information is too much information, right? And if you are not used to seeing your glucose live, or you can imagine somebody that's newly diagnosed or that's never seen like glucose before, having all of that information, it can be very overwhelming. So there's certainly patients that it can be distressful, psychologically, like all of this information is overwhelming. So, you definitely have to kind of figure out and filter through who things are appropriate for sure.
And when you say patients come in or they get tipped off because they're feeling bad, what are some of the symptoms that most often are tipping patients off to seek a second opinion or even an initial diagnosis?
Sure. So the symptoms of diabetes typically are fatigue, feeling tired. They may get frequent infections because when blood sugar is higher, you're just more prone to getting infections like common colds, viruses. You can have what's called polydipsia or excessive thirst. Feeling very thirsty or feeling very hungry is usually a symptom. From hyperglycemia, or having more urination, urinating more frequently, and just different symptoms like that. But those are usually the most common ones. Many people do come in that are more aware because type 1 is an autoimmune disease. So when we see one autoimmune disease, you're usually at risk for another autoimmune disease. So certainly patients that have maybe like a thyroid condition or potentially like psoriasis or celiac disease, or maybe have autoimmune in their family, they're coming in and they're wanting to get screened and making sure, hey, I have this. Do you think I'm at risk for diabetes? So they're certainly more aware.